Managing high blood pressure as we age isn't just about eating right or staying active, it's also about watching the medications we take. For millions of older adults in the US and beyond, the real challenge lies in avoiding hidden dangers that can sneak up through drug interactions. These interactions, involving everyday prescriptions, over the counter meds, or even supplements, can quietly raise blood pressure, working against your efforts to stay healthy. As seniors, we often juggle multiple medications for things like arthritis, diabetes, or sleep issues. But some drugs, even ones that seem harmless, can mess with your blood pressure meds or directly spike your numbers. The result? Your readings creep up, sometimes dangerously, despite all your hard work. What's tricky is how subtle these interactions can be. A cold remedy, a painkiller, or an herbal supplement might seem safe, but when mixed with certain conditions or meds, they can make hypertension harder to control, raising risks for heart attack, stroke, or kidney issues. The good news? Awareness is your best defense. By knowing which combos to avoid and working with your doctor or pharmacist, you can keep your blood pressure steady and take charge of your health. In today's video, we're diving into 6 common drug interactions that can raise blood pressure, especially for seniors. These are everyday risks you might encounter at the pharmacy or in your medicine cabinet, but they often fly under the radar. If you or someone you love is managing hypertension, this guide is a must-watch. Let's uncover these hidden threats, sidestep complications, and make sure every pill you take supports your health, not sabotages it. Part 1. NSAIDs and blood pressure meds, a risky mix. Let's start with one of the most common culprits, NSAIDs, or non-steroidal anti-inflammatory drugs like ibuprofen, Advil, Motrin, or naproxen, Aleve. These are go-to options for arthritis, muscle aches, or headaches, but they can quietly undermine your blood pressure control. NSAIDs block enzymes that produce prostaglandins, which help with pain and inflammation, but also keep blood flowing smoothly to your kidneys. When NSAIDs mess with this, your kidneys hold on to sodium and water, increasing blood volume and tightening vessels, which spikes blood pressure. This is especially risky if you're on ACE inhibitors, diuretics, or beta blockers for hypertension. NSAIDs can weaken these meds' effects and even harm your kidneys, particularly if you're dehydrated or have kidney concerns. Take Ellen Harper, a 70-year-old retiree from Boise, Idaho. Ellen was diligent about her blood pressure, keeping it steady with a diuretic. But when she started taking ibuprofen daily for knee pain, her readings jumped from 130/80 to 155/90. She thought it was just aging until her pharmacist pointed out the ibuprofen. Switching to acetaminophen Tylenol and adding physical therapy brought her numbers back down. "I had no clue my pain pills were the problem," she said. If you're managing hypertension, talk to your doctor before using NSAIDs regularly. Safer options like topical creams, physical therapy, or acetaminophen can help without the cardiovascular risks. Staying proactive keeps your heart and kidneys safe. Part 2. Decongestants and hypertension. Cold meds with a catch. When allergy season hits or a cold strikes, it's tempting to grab an over-the-counter remedy for stuffy noses or sinus pressure. But many of these, like pseudoephedrine, Sudafed, or phenylephrine, are decongestants that can spike your blood pressure. They work by narrowing blood vessels in your nose to reduce swelling, but that constriction spreads to your whole system, raising blood pressure and heart rate. For seniors on blood pressure meds, this can push readings into dangerous territory. Consider Tom Rivera, a 72-year-old from Tucson, Arizona. During a bad cold, Tom took a popular decongestant. Within days, he felt jittery, and his blood pressure shot from 125/75 to 106/95. His doctor flagged the decongestant and switched him to saline sprays and a decongestant-free antihistamine. His numbers stabilized quickly. "I thought it was just a cold med," Tom said. "Now I check labels like a hawk." To stay safe, look for decongestant-free cold or allergy meds. Options like saline sprays, loratadine, or cetirizine are gentler choices. Always check with your pharmacist before trying something new to avoid undoing your blood pressure progress. Part 3. Antidepressants and blood pressure, a mental health trade-off. Mental health matters, especially as we age, and many seniors turn to antidepressants like SNRIs, venlafaxine, duloxetine, or tricyclics, amitriptyline, for depression or anxiety. These can lift your mood, but may also raise your blood pressure. SNRIs boost norepinephrine, which can tighten blood vessels and increase heart rate, counteracting your blood pressure meds. Tricyclics can cause unpredictable blood pressure swings, including sudden drops when standing. Take Margaret Chen, a 75-year-old from Seattle, Washington. After a tough year, she started venlafaxine for depression. Her mood improved, but her blood pressure climbed from 135/85 to 150/90 with occasional dizziness. Her doctor switched her to an SSRI, which is gentler on blood pressure, and added counseling. Her numbers stabilized, and she felt better overall. I didn't want to choose between my heart and my happiness, she said. If you're starting an antidepressant, monitor your blood pressure closely, especially in the first few weeks. Report symptoms like headaches or dizziness to your doctor. Non drug options like therapy or exercise can also support mental health without cardiovascular risks. Part 4: Herbal supplements, not always as safe as they seem. Herbal supplements are popular for boosting energy, sleep, or immunity, but some can wreak havoc on blood pressure. Ginseng, licorice root, and St. John's wort are common culprits. Ginseng can spike adrenaline, licorice causes sodium retention, and St. John's wort can weaken blood pressure meds by speeding up their breakdown in your body. Take Clara Nguyen, an 80-year-old from Orlando, Florida. Clara used ginseng tea for energy and licorice supplements for digestion. Soon, her blood pressure rose from 128/78 to 148/88 with headaches. Her doctor identified the supplements as the issue, and stopping them brought her numbers back down. I thought natural meant safe, Clara said. Now I double check everything. Always talk to your doctor before adding supplements, even natural ones. They can act like drugs and disrupt your blood pressure control. Reading labels and asking questions keeps your heart protected. Part 5: Corticosteroids, relief with a risk. Corticosteroids like prednisone or dexamethasone are prescribed for conditions like arthritis or asthma. They're great at reducing inflammation, but can raise blood pressure by causing sodium and water retention, increasing blood volume. They also deplete potassium, which affects blood vessel relaxation. James Patel, an 82-year-old from Raleigh, North Carolina, was prescribed prednisone for a rheumatoid arthritis flare-up. His blood pressure jumped from 130/80 to 160/95 within days. His doctor lowered the dose, added potassium-rich foods, and monitored him closely. After finishing the course, James's numbers normalized. The relief was worth it, but I didn't expect the side effects, he said. If you're on corticosteroids, check your blood pressure often, stay hydrated, and cut back on salty foods. Report symptoms like chest tightness or blurred vision immediately. Your doctor can adjust doses to balance relief and risks. Part 6: Hormone therapies, a delicate balance. Hormone replacement therapy, HRT, for women or testosterone therapy for men can ease aging symptoms like hot flashes or fatigue, but they can also raise blood pressure by affecting blood vessel tone and fluid balance. Estrogen and progesterone in HRT can activate systems that narrow vessels, while testosterone can thicken blood, increasing hypertension risks. Linda Martinez, a 74-year-old from Denver, Colorado, started HRT for menopausal symptoms. Her blood pressure rose from 120/76 to 140/88 with swelling in her ankles. Her doctor adjusted her dose and added yoga for stress relief. Her readings improved and she felt balanced again. I needed relief, but I had to protect my heart too, Linda said. If you're on hormone therapy, monitor your blood pressure regularly and report symptoms like headaches or swelling. Your doctor can tailor your treatment to minimize risks while maximizing benefits. In closing, managing blood pressure isn't just about lifestyle. Medications and supplements play a huge role. From NSAIDs to decongestants, antidepressants, herbs, steroids, and hormones, these hidden interactions can derail your efforts. But with knowledge, careful label reading, and open talks with your doctor, you can avoid these traps. Small changes like switching meds or monitoring at home make a big difference. So